when you induce changes with exercise or you induce changes with fasting, they're often the same changes. If you look, for example, exercise, people that exercise, 2 rats in a cage, genetically identical. Give one rat an exercise wheel and the other not. Everything else is equal. The rats with the exercise wheel, 1, they'll use it, and number 2, they don't get Alzheimer's disease and dementia. And they said, well, why? How does exercise prevent dementia? And they look at those rats and they find out that BDNF, brain-derived neurotrophic factor, is dramatically higher in rats that get their exercise, lower in those that don't. BDNF goes up with water fasting just like it does in exercise. Glycogen mobilizing enzymes go up in exercise just like they do in fasting. In fact, all of the biomarkers that we've been able to look at that are improved with exercise improve with fasting, which is weird because you think, well, wait a second.
Wild.
Exercise, you're out vigorously running around inducing all these changes. Fasting, you're sitting around, we don't even let you exercise much. You maybe could do a little yoga. How is it that they would do the same thing to the body? But when you think about it, exercise and fasting are both reversing the consequences of dietary excess. When you exercise vigorously, when you fast, you're undoing the consequence of dietary excess. I'm not surprised at all that fasting induces the same kind of biochanges that we see with exercise. In fact, for us, it's saving a lot of time because we just look at all that vast exercise literature and start looking for the things they've discovered and seeing how much of it's mimicked with fasting. I think that both of these processes, fasting and exercise, share a common biological benefit. And that's why we're seeing the biomarkers changing with both. The other thing that happens is insulin. Insulin is the hormone that drives sugar from the bloodstream into the cells where it's needed to burn. So if you look at type 2 diabetics, you might assume mistakenly that they don't have enough insulin. They have plenty of insulin. They have more insulin. It doesn't work because there's insulin resistance. There's resistance to the insulin carrying out its function. So what drug can you take that reverses insulin resistance? There isn't any. There's drugs that'll force sugar on the cell and they have all kinds of side effects. What can you do to reduce insulin resistance? Well, you could exercise. That helps. Weight loss, healthy diet. You can fast. Fasting has a profound effect on insulin resistance. In fact, as much as 80% of our type 2 diabetics can achieve normal blood sugar levels without medication. And if they're willing to continue to do the diet and the exercise, they can often sustain those results. Now, you might say, well, couldn't they do that with just diet and exercise? Absolutely. Many diabetics that are able to make aggressive diet and lifestyle changes over enough time are successful at resolving and reversing their diabetes, but it's difficult. For people that aren't able to do it on their own, that's where we would use the next level of support and intervention, which is fasting. It can also be a little tricky unwinding the medications and all that kind of stuff. So, doing whatever it is, whether it's feeding or fasting in conjunction with doctors that are able to be supportive and that have an expectation of you getting well is important. Now think about it. If you go to a doctor and you've lost weight, does the doctor assume you've adopted a healthy diet? No. They assume you've got an eating disorder, you're a drug addict, or you're dying of cancer. That's the differential.
Yeah.
Colon cancer, eating disorder, drug addiction. Because many doctors have never had an experience of a diabetic getting well. I gave a lecture this year in Texas at a medical conference for physicians who specialize in diabetes. So there's 250 people there. What are they serving them? Pulled pork sandwiches, chocolate cake. Most of them are overweight or obese. I do my presentation. I explain our results. Afterwards, one of the docs comes up. He's about maybe 70, 80 pounds overweight. He says, I've been in practice 25 years treating diabetics. I've never seen one get well. Mm-hmm. He's never had the experience of a single patient recovering, stabilizing their blood sugar, getting off medication. It's not part of the paradigm. Well, how likely is he going to give meaningful diet and lifestyle advice to a patient when he doesn't do it himself, doesn't even know that it would work, or even if he thought it would work, knows the patient's not going to do it because people don't make diet and lifestyle changes. He's seen the literature, 93% recidivism rate, to ask people to make diet and lifestyle changes, very difficult. And so they're willing to put the extra time and energy and effort in. But if you're in a traditional system, if you're in an HMO system and you're a physician and you have to see 26 patient contacts a day, do you think you have time to review their history, do an exam, write the prescriptions, and then sit and chit-chat about them, why they've got to give up everything that they eat? But for people that are willing and interested, they should at least have the right. Somebody that should at least say, well, you could go on this diet and lifestyle, but it's a lot of work. Or you can
Right.
just take these pills and you'll be sick forever. What do you want to do? But they don't even know that. It's not. I can guarantee this physician I was talking to never tells his patients, well, if you did radical and diet lifestyle changes, you could get, well, I'll give you an example. My brother's 6 years older. So we're raised together. He's slowly gaining weight. His wife adopts our diet, comes in and fasts, overcomes her own health issues, is on a vegan program. 15 years later, my brother's still eating chicken and doing stuff and getting fatter, and he can't play volleyball anymore. His legs all swollen up. I'm poking him, but he won't do anything. Finally, he calls me from the hospital. He says, Alan, I'm in the hospital. I had a heart attack. I said, that's great. He goes, no, you don't hear. I had a heart attack. I said, I heard you. Best thing that could have happened. So he said, they want to do a quadruple bypass. And I said, well, talk to your surgeon. He asked the surgeon, he says, if you do a bypass, won't they plug up again? And the surgeon said, yeah, eventually, but it lasts longer than stents. And he says, what if I made radical diet and lifestyle change? He said the surgeon laughed at him. He said, Mark, you're not going to make diet and lifestyle changes. Come on. Checked himself out, got on a whole plant food SOS-free diet, lost the 50 pounds, back to playing volleyball, passed his stress test, still has his vessels. And in my brother's case, he had the advantage. His wife, my sister-in-law, already doing the work of providing support to the family with healthy food and stuff, but still difficult. Now, I just saw him a few days ago. Looks great. Completely different person. Do you think he's going to no, it wasn't worth it? No, it's the best thing he's ever done. I actually think the people that are going to turn out to get the most benefit from fasting, this 1 and 2 week fast that we do with healthy people, is healthy people. Healthy people that are looking to stay healthy. For example, to avoid vulnerability to infectious disease, to avoid the problems that, not waiting like my brother did till he has a heart attack, but the people that are willing to use it to prevent the problems from the beginning. And interestingly enough, I've been communicating with Walter Longo recently about doing a joint study where we're going to use his expertise and access and our facility to do some look not just at intermittent fasting, but long-term fasting, and compare and contrast and see what the very best bang for the buck, so to speak of, is in terms of taking healthy people and helping them stay that way. We've got a study that's planned for next year looking specifically at exotic biomarker changes with these dietary changes, with fasting, and then trying to differentiate how much fasting, how frequently, what's the right combination. That's all relatively new territory. There's other impacts of fasting that are not as well recognized. For example, the gut. You have a tunnel through your body that starts at your mouth and it goes down your esophagus and then your stomach and your intestinal tract and it gets to the rectum. You got a hole at one end and another hole at the other end. And digestion is essentially shoving things in one hole, trying to push it out the other hole.